I just wanted to thank Andrea and the other organizers of this conference. I think it's just a really timely topic. And I'm really excited to be here to present and tell you kind of a little bit more about color, as well as just it's been fun really getting to know you guys and cross-pollinating today. So my background is I'm a board-certified pathologist with subspecialty boards in molecular genetic pathology and an additional fellowship in pathology, oncology, informatics. It's pretty far subspecialty trained, but essentially what that means, although it didn't have a name at the time, is I'm a precision medicine doctor. And so I specialize in running these kinds of laboratories, developing these kinds of assays, looking at DNA and other kinds of analytes in massively parallel fashions and using computers to kind of distill it down and come up with new and better and more effective ways of predicting what drugs your diseases might respond to or what diseases you might be predisposed to developing. And I left academia and came fully out to Silicon Valley in 2011. I say fully because before that I actually had a startup that while I was still in academia that was partially based out here. But I really was out of frustration in our incumbent healthcare system because, as you guys probably noticed, it's really broken. And I decided that it's impossible to fix it from within. And so I decided to come out here and join forces with the tech entrepreneurs and see if we can kind of grab, some bite-sized tractable problems and start to solve these one by one. And there's no danger of starving. There's a lot of low-hanging fruit and a lot of things that could be improved. So color itself, I joined about a year ago, and it is a preventative health services company. And we really focused on prevention because we think this is a gap in our current incumbent health system. Nobody's really incentivized to pay for prevention. Nobody cares about your own health more than you. So the healthcare consumer is incentivized to pay for prevention. And then the only other key stakeholder that is the self-insured employers. You want to keep your employers happy and healthy for decades to come. And so that's why I think this is such a timely conference to be having, and that we've got so many opportunities with health tech meeting up in the channel with self-insured employers. So, the first few slides anyway are just, here we go. Just gonna kind of emphasize that the system's broken and everything costs too much, but I think that that point's probably been driven home already by all of the other speakers, and it's not news to anybody. One example, and where Color has chosen to start in its flagship product, is a preventative genetic test, particularly in hereditary cancer syndromes. So these are conditions like BRCA, which is hereditary breast and ovarian cancer syndrome. It's what Angelina Jolie had. So these are changes, mistakes in the instruction code book in your DNA that makes you significantly predisposed to develop cancer in your lifetime, and also where there are overtly actionable guidelines for things that you can do to prevent yourself from getting that cancer. And there's been a number of reasons why we haven't been able to do this and why our system's not doing it well that I'll get into, and then we'll kind of go more into the Color experience. But obviously, if we can detect these cancers earlier, you're going to have a better 5-year survival rate than if you detect these cancers later. So if you know you're predisposed, we can catch it earlier, and then it follows that it's actually cheaper if you catch these earlier rather than later. So here's this frying pan to the face rationale for why we should be finding out who's at risk for these cancers and either preventing them from happening altogether or detecting them earlier. Yet we spend less than 3% of our healthcare spend on prevention. And as this quote goes, I've always said it, the way I do the quote is, we have a sick care system, not a healthcare system. It only pays for you after you get sick. Everybody makes money the more sick people we have. The pharma companies make more money selling drugs to sick people. The device companies make more money selling devices to sick people. The doctors make more money doing procedures on sick people. And so, like I said, there's very few stakeholders who are really incentivized other than the healthcare consumer and the self-insured employers. And like I said, that's, okay, we'll go to the slide. Like I explained, when we're looking at the DNA, we're just looking for changes in the instructions that tell the cells how to behave. And we've got, in the last 10 years, new technology that allows us to do that significantly better and cheaper. And it's, for example, a test to look at the BRCA1 and 2 genes 5 years ago cost $4,000. You can now do it at color for $249. And at this point is just driving home that we know that these people, there's 1 in 200 people are walking around out there with a BRCA mutation. In this room, there's at least one person with a BRCA mutation, and 90% of people don't know it. And the reasons for this are essentially threefold. Physicians, especially physicians in my era, weren't trained in genetics. We're doing a better job now. So the kids going through med school now are getting better genetics and genomics education. But everybody who's come before them, we got a 2-week course in the first year at the same time we were taking gross anatomy. And it was essentially a throwaway course. Like, everybody just kind of faked their way through it. And then that was it. And then you never got any more genetics again in your entire training and education to become a physician. So even if they could remember what they learned in that 2 weeks 20 years ago, it's wildly out of date because these new technologies have taught us so much in the last 10 years that we didn't know. And affordability, like I already told you how expensive it used to be to do this kind of testing. And so we kind of came up with guidelines in the healthcare system that said, because this is so expensive, we have to use it really judiciously and, only on the patients that we really think are probably positive, like have a lot of personal and family history of cancer, for example. But now we know that if we only test those people who are at high risk based on their personal family history, we're still missing 50% of the people who have BRCA mutations. And then accessibility. So even when people are high risk and the doctor says you should go get a genetic test, it's there's so much friction in the experience that there's still a lot of attrition. Less than 20% of people who are known to be at high risk of being positive for a BRCA mutation actually go through to get the testing. You've got to take a day off work. You've got to go to see a genetic counselor, which is in a medical genetics clinic, which is only in a tertiary care hospital. So if you live next to Stanford, it's okay. But if you live, anywhere else, you're driving 100 miles or more to get to your closest tertiary care center. You're going to wait, get in to see the genetic counselor, talk to them for an hour. They'll decide if you get the test, and then you go get in another queue in another building, wait to get your blood drawn. 4 weeks later, they call and say your results are in, and you've got to go do the whole thing all over again. And so with these 3 barriers, we just really have been dropping the ball and missing a huge opportunity for prevention in hereditary cancer syndromes. So what if we provided families access to genetic health information in an affordable and easy way? And I'm going to invite my colleague Parul up in a minute, but I just wanted to recall a time at the lunch table where we were all kind of chatting about what was the definition of engagement. And it was the woman from Collective Health, can't remember her name, but she explained, I thought really well, like the difference between little e engagement and big E engagement. And little e engagement is like, did you get them to, use the tool, right? But big E engagement is, overall, are your employees happy and satisfied and feeling like motivated to do the best job that they can do and stay, at this company with loyalty. And that's the big E engagement. And so we've got a number of customer testimonials that we've videotaped, and we've got them on our website. But I actually thought Parul is here, and she's actually part of our enterprise team, and she's a cancer survivor and a BRCA carrier. And I'll just give her an opportunity to tell her story.
Thanks. I'll grab the clicker from you, too.
Oh.
Hello, everyone. I'm honored to be here to share my story because I believe it really highlights 2 very important sides to genetic testing. One is the patient experience and really illuminating the shortfalls that exist in the traditional system today. And the other side is just how powerful this knowledge can be and how it truly can save someone's life. On the patient experience side, so I was 29 years old and just in an appointment with my OBGYN and discussing family history and how my mother had early onset breast cancer. I was fortunate to have an OBGYN who was more aware of genetic testing and on the forefront who recommended that I get it. I didn't really know much about it. It seemed rather simple with her. It was just a saliva swab, and so I said, sure, why not? I didn't necessarily have much counseling or training or anything about what it would mean, but it seemed rather easy to just get the saliva swab done. But then that's where the friction started, because I wasn't exactly sure how much it would cost. And she said, don't worry about it. Insurance will let you know if they'll cover it or not, and if not, how much it'll be. So my saliva goes into this black box experience. I have no idea where it's going, when I'm going to hear back about it. And days, maybe weeks go by, and I suddenly hear from the insurance company saying that I've been denied coverage. And I'm a little baffled because my own mother had early onset breast cancer, but apparently that wasn't sufficient to meet insurance criteria for coverage. So I then began an exploration of my own family history and find that there are, in fact, other incidences of cancer, and I ultimately get that insurance coverage approved. But now I don't know when I'm going to get my results back. And I was actually in a car on the way to the airport for a friend's wedding when I get a call from my doctor to let me know the results of my genetic testing. And she shares that, I'm sorry to say, but you carry a mutation in the BRCA1 gene. And I don't even know what that means, but I immediately start bawling because it felt like I was getting a diagnosis. And I had had no counseling to really understand how this information is important and how I can act on it. And what she had to say was, make an appointment in a couple of weeks, and we'll talk about your results then. So you can imagine how wonderful and joyous those 2 weeks were of my life. I did ultimately learn to understand what those results mean. And what it meant is that I had a very elevated risk of breast cancer. While the average woman has a maybe 10 to 12% chance of lifetime risk of having breast cancer, for me, with my mutation, it was over 80%. And so at the age of 29, because I had the genetic testing done and I had these test results, I was able to start a screening program and start mammograms and MRIs at an age much earlier than the average person would, and actually have my insurance cover it. But more importantly, it created in me an awareness of my own risk and how I need to be more proactive about my health, which came very handy 2 years later when I was 31 years old. And I was actually 38 weeks pregnant with my second child when I felt a lump. And I was immediately concerned because I had this heightened awareness. But I had multiple healthcare providers indicate that it's probably nothing to worry about because I'm young, I'm pregnant, lumpiness is very common. But because of the genetic test results, maybe I should just go ahead and get an ultrasound done. 2 days later, however, my water broke 2 weeks early, and I delivered my daughter. But because of that genetic testing, even after my C-section, I insisted on getting that ultrasound and biopsy. And my husband wheelchairs me from the NICU to the breast clinic, and we get this biopsy done. And even there, the breast surgeon who's doing my biopsy said, it feels really soft, it's probably a milk duct, nothing to worry about. Go home, enjoy time with your baby. So I do. But unfortunately, 2 days later, 2 days after getting home from being discharged at the hospital with my baby, I get the diagnosis that I do, in fact, have early stage breast cancer. And this story is so powerful to me because I think back at the circumstances around that diagnosis and how I was young, I was healthy, I had just had a baby, and multiple people were telling me it's nothing to worry about, and just how easy it would have been to dismiss and accept that, yes, in fact, it isn't anything to worry about. And sure enough, by that point, after delivering my child and my milk had come in, I actually couldn't feel the lump anymore. And you can only imagine if I had waited a year until I could feel that lump again and only gotten it, the ultrasound done at that time, how different my prognosis would have been. By catching it early, like Jill shared, that survival rate from my own life story is so different. had it been at an advanced stage, I would have only had a 25% chance of surviving at the 5-year mark. But by catching it as early as I did, that same survival rate jumps to 98%. And I truly strongly believe that it was because I had gotten that genetic testing done, because I had that awareness of my own risk profile, that it empowered me to insist, despite all of the crazy circumstances going on at that time, really insist on getting this testing done. And today, I'm proud to be here as a cancer survivor and sharing my story and working for a company like Color that is not only empowering more people, more populations to get access to this genetic testing, but is doing it in a way that's more affordable, more accessible, and really improving that patient experience that wasn't necessarily as smooth when I had it, and have since gone through the Color process myself, have had my whole family go through Color testing, and it was actually only years after finding out I'm a BRCA carrier, and only years after actually battling breast cancer, that I ever had a genetic counseling appointment, and that was because I now work for Color, and I did Color testing.
Thanks, Parul. So it's because of stories like this, and one of our co-founders actually is a BRCA carrier as well. His mother is a breast cancer survivor twice, and his grandmother died of breast cancer. And even with a relatively affluent family, their entire family struggled to get access to this testing. And he was just like, this is ridiculous. Like, there's no reason that it has to be this hard. And in true Silicon Valley style, he kind of sat down and did the, consumer-centric design theory. What would be, if we could start all over, like, how would we really design this? And what would be in the best interest of that patient? And what would, get the best follow through all the way through the system, while still maintaining the appropriate touch points with healthcare providers? And so that's what Color's flagship product is. And we have additional products in cardiovascular that really kind of tell the same story. So we wanted to go after our first two products really being in the two areas that cause the most morbidity and mortality in the United States, cancer and cardiovascular. And this is what we came up with when we did the consumer-centric design theory redesign of this experience, is you actually order it at home. You can use your own physician to order the test if you don't have a physician, because a lot of people, especially younger people, don't have a primary care physician in this country. So we have an independent third-party network of physicians that will review your health history and make sure that this is the right test for you. And then we'll send you the kit. In your kitchen, it's a saliva sample, stick it back in the mail, and then all the rest of the experience is going to come through online for you. And the genetic counseling is complimentary and all the way through the process. From before you take the test, during the testing process, after you take the test, a year after you take the test, anytime you've got a question, you can call one of our genetic counselors, and they'll either advise you on what you should do, or if it's a more complicated question, make sure that you get in to see a healthcare professional who can actually sit down with you in a full clinic setting. And then you can share the results. You can share the results with your healthcare providers, and you can put as many doctors in as you want, and we'll share it with as many as you like. And then importantly, you share it with your family, because genetic diseases are family diseases. And so here's what some screenshots from the Color experience. It looks a lot different than if anybody's ever gotten a laboratory test. Has anybody ever got like the LabCorp lab report? Yeah, it's not very consumer friendly. That's not consumer-centric design theory. So this is what the Color experience looked like. And you can see on the one side there's the family tree. So another one of the big failures of our incumbent healthcare system, and it simply cannot be fixed from inside the system, is that we know that genetic diseases are family diseases, but our entire health system is not set up to take care of a family. Like, it's a HIPAA violation if we try to take care of a family member. So, doctors practicing inside the incumbent healthcare system can't do this. They can't reach out to those at-risk family members. But in Color, we've built a HIPAA-compliant experience where we kind of make the proband, the person that we identified as the positive, the champion for his or her family, and then they can use their own email, kind of in our experience, to send these emails to their at-risk family members, and we populate them to make sure that it's accurate in an 8th grade level. And then, because we know that 50% of these people are also going to be positive and probably don't know it, we actually do that testing for $50. So we've been partnering with self-insured employers for a little over a year. I think we've partnered with over 50. People like Visa and Salesforce, SAP, GE Appliances. And so we've actually, we've got a whole team dedicated to it now, and they'll come out and they'll, do on-sites with the genetic counselors, answer any questions that your employees might have, and then give them access to the testing. And that's, the last point that I want to make before my time runs out is that I hope you can see that there's, enormous opportunities for partnerships between health tech and self-insured employers to make significant and tangible improvements to the healthcare experience in the United States. And this is an example of how we can do it in prevention of cardiovascular and cancer. But it's important to make sure, as different health tech, we all need to work on this together as a community to make sure that when these health tech companies are coming in and pitching to you, that you're making sure they're not selling you snake oil. Because the first time that somebody's can't back up their claims or their test doesn't work the way they told you that it would work, and there's a bad outcome, this channel gets closed for everybody, and all the good that we can do gets limited. And so I just, in my last couple of slides, just want to give you 4 quick questions to ask a medtech vendor when they come in. And this is kind of designed around if it's a laboratory test. You can ask them, are you FDA approved or cleared? And if they say yes, that's good. You're fine. But most of the people, especially in genetics and genomics and laboratory testing, are going to be under a different regulatory framework, which is under CMS, and it's called CLIA. And then there's another entity called CAP that does the accreditation. And so you really want to make sure that they're CLIA and CAP accredited. And I've worked at a lot of health tech startups in Silicon Valley at this point, and they start off just really well-intended, ambitious, want to do good, tech entrepreneurs who really aren't aware of the regulatory environment when they start out, and may not even know that you actually, there's federal laws about how you do this stuff. So make sure that they're aware of those. Make sure that they've got good credentialed people doing any kind of interpretation and oversight of the laboratory. And probably if you're only going to ask one question, ask them, do they have a clinical dossier? If they don't know what it is, that they're probably a little bit too early in their life cycle. If they do have one, they've probably handed it to you when they walked in the room. And these are the, kind of the 3 things. The top 2 are just the sine qua non, right? You just got to, does your test or your device do what it says it does? If there's a change, does it detect a change when the change is there and not detect the change when the change is not there? The next question is, what does it mean? So if you tell me when that change is present, it means you're going to get cancer. Where's the data that shows me that finding, your claim about that finding is true? And then the last one's optional. But a lot of times people want a return on investment or a clinical utility, is it actionable? And color, for example, focuses only on things that have established evidence-based guidelines for if you get a positive, if you get a positive, this is what you do. And so the last slide, I just wanted to end on, I'm gonna get up there now. Just to kind of close out with some kind of social proof points with the impact that color has had, and the feedback that we've gotten from our employer partners as well as the employees themselves. And again, hopefully get everybody kind of excited and inspired about the great opportunity that we have partnering between health tech and self-insured employers. 7 seconds left.